My name is Dr. Kelly McKelvey, and thanks to a Matt Calander Beanie for Brain Cancer HMRI Fellowship, I'm able to start to unravel what it is about brain cancer that makes it such a difficult disease to treat. We understand that brain cancer is able to switch off some of the immune response that we get from your own body. Your body has this wonderful ability to be able to protect you against cold and flu, and it has a capacity to be able to treat and cure brain cancer. My research specifically will look at the interactions, the communications between the brain cancer cells and your immune cells. What we're trying to do is to reinvigorate, reactivate the immune response to be able to firstly identify, target, and then to eradicate the brain cancer cells. We understand that brain cancer can switch these signals off, and what we need to do is to move this back in favour of the immune response. This will enable you to be able to treat the cancer for a number of years to come, in conjunction with some of the other treatments such as radiation and chemotherapy. What I hope from my research is to be able to tell the clinicians and tell the oncologists that these are the select handful of clinical trial drugs that we should be focusing on for our patients with brain cancer, so that we can have much better control over their treatment. At the moment, patients with the high-grade brain cancer, whether they're children or adults, do not have time to try multiple therapies. So, as quickly as possible, we need to identify that treatment or those 2 or 3 treatments that will give them the best chance of survival. What I want is to be able to double or triple the survival time for patients with brain cancer in the next 5 years. This 3-year fellowship for me is incredibly important. Often what happens is that researchers like myself have to spend some of their time applying for research grants as well as for salary. This 3-year fellowship gives me the ability to purely focus on the research, to understand the cancer, to understand the immune response, and to find the best treatment possible to allow us, our bodies, and your bodies to be able to kill off those cancer cells. I met Matt in palliative care, and it was a little confronting. Brain cancer is such a debilitating disease, both physically, mentally, and emotionally. For a man with such a young family to choose to promote brain cancer awareness and to spend his time fundraising is incredibly amazing. It's this character, that ability, the people person that Matt was, that makes the Beanie for Brain Cancer campaign so special. In conjunction with Mark Hughes, we hope to be able to raise not only the awareness but the funding for brain cancer. If you purchase a beanie for brain cancer, it will enable researchers like myself to be put in place to dedicate and spend all of our time on understanding cancer and being able to identify that treatment that will for once and for all be able to cure brain cancer.